Okay, let's go ahead and get started here. It's my honor and pleasure to introduce to you Dr. Rajiv Saini. He is a periodontist, researcher, and author, and a Harvard Medical School graduate specializing in clinical operations with a concentration in industry leadership. A dentist and periodontist by training, he is recognized for his expertise in oral systemic health research. His work primarily examines the host inflammatory and immune responses to periodontal infections, establishing periodontitis as a significant risk factor for various systemic diseases. Experienced in implementing scientific strategies in a variety of R&D operations with his major focus on projecting research value propositions and mapping new avenues for scientific growth and innovation. His scientific portfolio includes more than 170 peer-reviewed publications in high-impact journals, 5 books, 3 book chapters, and multiple patents. His globally recognized scientific contributions and numerous research awards highlight his pioneering role in scientific advancement. So welcome, Dr. Saini. Thank you for being here this evening. And thank you to H2 Ocean for sponsoring this presentation.
Good evening, everyone, and welcome to today's seminar on diabetes and oral health. Thank you, Dr. Rowling, for coordinating this important session today. Today, we will explore how diabetes deeply affects oral health and vice versa. We will also examine during this seminar the evolving role of dental professionals in managing diabetic patients, and we dive into clinical benefits of natural, mineral-enriched oral care products tailored for specific diabetic population. It's a disclaimer here. This continuing education webinar is sponsored by the company H2 Ocean, and I currently serve as the Chief Scientific Officer for the company and currently have a financial relationship with the company. Today, that's regular housekeeping. What's the agenda today here? It's a 60-minute presentation, and then it's followed by a corporate presentation as well for you to follow up with the products and the science behind the actual products. And that's your passcode and how you have to enter the quiz details to get your certification. I will skip my introduction as Dr. Rowling has already introduced me, so I will go straight into the topic now. These are our course learning objectives for today. We will identify the common oral health issues related to diabetes, such as periodontal disease, dry mouth, and infections. We will try to understand the impact of diabetes on oral health and its bidirectional relationship with the systemic health. We will also develop patient care strategies that we can incorporate for preventive and therapeutic approaches for managing oral complications in diabetic patients. And we will also explore the role of sugar-free mouthwash in maintaining oral health and controlling diabetes-related oral health issues. So let's begin with a quick overview and refreshing of our understanding about the disease diabetes. So diabetes occurs when blood glucose or blood sugar is too high. Glucose, the body's primary energy source, and it comes from food and is always produced internally. So insulin, a hormone made by pancreas, allows glucose to enter the cells and to be used for energy. In diabetic conditions, either insulin is not produced sufficiently or it is not working efficiently. As a result, the glucose remains in the bloodstream, does not enter into the cells, and leading to a high blood sugar levels. That's why the role of insulin is very important in management of diabetes. As for in general accounts, we can say that there are 3 main types of diabetes. Type 1 diabetes, it's also known as an autoimmune condition where the pancreas produces little to no insulin. It's commonly diagnosed in children or very young adults, and it requires almost a lifelong insulin therapy. The type 2 diabetes is a condition that's the most common type of diabetes The body becomes resistant to insulin, or we can say that, or doesn't produce enough insulin. It is often linked to obesity, genetics, or lifestyle, and it can develop at any age. And the third type of diabetes is gestational diabetes. It occurs during the pregnancy, and it usually resolves after childbirth, but increases the mother's risk of developing type 2 diabetes later on in the life. Now, let's look upon some of the significant statistics related to diabetes. Since 1990, the global diabetes cases have quadrupled, now affecting over 800 million adults. That's huge. Alarmingly, 60% of these individuals remains untreated, highlighting the gaps in access to the care. Contributing factors mainly are obesity, sedentary lifestyles, unhealthy diets, and socioeconomic disparities. Now, this is a very interesting slide and kind of very disappointing slide as well. This is a projection from International Diabetes Federation, and they estimated that you know by 2045, 1 in 8 adults globally will have diabetes, and that's about 783 million people will be living with diabetes, a staggering 46% increase. So that's huge number. I mean, right now, when you look upon the statistics in the US, 1 in every 10 person is diabetic, and 1 in 5 person doesn't know they have diabetes. That's huge. And pre-diabetic condition is even so huge, like 98 million Americans adults are pre-diabetic right now. More than 1 in 3 have pre-diabetic, and more than 8 in 10 adults with pre-diabetes, they don't know they have it. So it's kind of we usually say it's kind of a silent killer, where the person is also not aware what's going on inside their body and health. And as I mentioned that by 2045, this condition become very increasingly alarming, and about 783 million people worldwide will be living with diabetes. And it will be almost like 45% increase in diabetic populations in another almost 2 decades. So it's very huge, it's very alarming. And so we as a dental professionals should be ready in order to understand what should be done in terms of managing this situation in a very proper way. Let's understand the cost related to diabetes and the dollar amount that is involved. So $413 billion, that's the total medical cost and the loss in the wages and the work for the people with diagnostic diabetes. It's huge. It's a huge burden to a healthcare system. It's a huge burden to the overall financial system of a country. Medical costs for people with diabetes are more than twice high as for a people without diabetes. And no doubt, other than the cost factor, diabetes affects more than blood sugar. The long term complications include cardiovascular disease, kidney damage, nerve damage, retinopathy, loss of vision. It also impairs the circulation and immune responses, factors that contribute to oral health problems and delayed wound healing. So these are the multiple factors where diabetes not only affecting the dollar amount but also affecting the overall health status of a person. From for the oral health perspective, diabetes and oral health is a two-way relationship, or we can say that it's a bi-directional relationship. There is a well-established relationship between diabetes and oral health, and there's a huge amount of scientific data, research papers, scientific evidences, clinical facts that establish diabetes and periodontitis as a bidirectional health disease. Diabetes increases the risk of chronic periodontitis or the gum infection, and in turn, periodontitis can worsen glycemic control by promoting systemic inflammation. So, this bidirectional relationship is driven by elevated pro inflammatory cytokines, primarily like interleukin 1, interleukin 6, tumor necrosis factor alpha, oxidative stress, and immune dysfunction. Advanced glycation end products, or commonly known as AGEs, are harmful compounds formed when protein or fat combine with the sugar in the bloodstream. So, and a process accelerated in diabetes. So, when we say a person has a high amount of AGEs, it's related to because of the combination of the sugar with the proteins or fats. And these elevated AGE levels contribute to chronic inflammation and oxidative stress, and thus damaging tissues and impairing the wound healing. In the oral cavity, AGEs exacerbate periodontal disease by promoting collagen breakdown and reducing tissue regeneration. They also impair immune response, increase susceptibility to infections. So, therefore, managing blood sugar and reducing AGE accumulation is very critical to maintain oral health in diabetes population. So, when we talk about diabetes, these are the list of the conditions: xerostomia, dental caries, periodontal disease, oral infection, burning mouth, altered taste, mucosal irritation, poor wound healing, and increased chances of periimplantitis. So these are the common factors which we can see when a patient is dealing with diabetic conditions. And we'll discuss some of these factors which are very prominently seen in the diabetic population. The number one is xerostomia. So the prevalence rate of xerostomia in a diabetic patient is 34 to 51%. That's very high. So it's almost like 50% of his time, the patient experience the dryness in the mouth. And its pathophysiology is basically involved because of the impaired salivary function. People dealing with diabetes often found difficulty in eating, swallowing, and speaking. They may have one symptom, they may have both the symptom, or they may have a combination of multiple symptoms. The degree of xerostomia is always related to glucose level in saliva. Many studies have found that xerostomia or dry mouth is more prevalent in individuals with diabetes. Reduced salivary flow is common and can lead to a greater risk of tooth decay, oral infections, poor quality of life, especially when blood sugar is uncontrolled and dehydration is present. Diabetic is one of the most common metabolic condition with salivary implications. So we have to be very, very conscious when we clinically observe a patient in dental clinics by taking the history, what is the status of the diabetic condition at the time of clinical examination. There's a lot of studies. It's a very interesting article, and this comprehensive review of literature, comprehend research articles from 1970 to 216. So a bit of a huge data that reinforces that there is a strong link between diabetes and xerostomia. So we have a huge scientific data that confirms that diabetic population have an increased risk of xerostomia. Another important condition is dental caries. Uh, in diabetic population, there is always susceptibility to the new caries formation or recurrence of the dental caries. The pathophysiology is very complex because xerostomia is involved, dryness is involved, microbiome is changed, and a lot of factors come into the picture. Chronic hyperglycemia may cause irreversible pulpitis also, leading to pulp necrosis. Then patient has to go for its endodontic treatment. Now, diabetic patient are 3 times more likely to develop dental caries as compared to the person who is non-diabetic. So that's huge risk factor, 3 times. And this is due to reduced salivary calcium, because when the flow of the saliva is less, and definitely the minerals from the saliva is reduced, especially the calcium, and that increases the chances of demineralization of the tooth, decreased flow rate of saliva, and lower pH levels. All these conditions, and when salivary components are imbalanced, they fail to protect the enamel and therefore increase susceptibility to decay. So that's why it's very important. Now, this is an interesting study that is published recently, and they mentioned that this study confirms that diabetes alters the physiochemical properties of saliva and weakening its protective role. So when a person is dealing with a diabetic condition, not only the salivary flow is reduced, but the quality of the saliva, the minerals of the saliva, the natural elements of the saliva is also reduced. And all these factors contribute to the risk of developing the dental caries. Another important condition which we often see in diabetic population is periodontal disease, and it always starts with a gum infection. The prevalence rate is extremely high. It's almost 39 to 59%, and it's mainly attributed to, you know, uh, the alteration in the host defense. And they adversely react to the chronic condition with diabetes. And as I mentioned earlier, it's a two-way relationship. The interplay between diabetes and periodontal disease is further supported by evidence showing that poor gum health can worsen diabetes and vice versa. This is one of the article that's published in 2011. It's written by me back 10 years or I think 12 years before. Periodontal disease is the sixth complication of diabetes. So that's huge, irrespective of the diabetes affecting multiple organs, heart, nerves, kidney, neuropathy. Diabetes is the sixth complication. Periodontal disease is the sixth complication of diabetes. So that's very significant, and that relies the importance of maintaining good oral health during diabetes. Now, let's understand how this system works in terms of physiology related to diabetes and oral health and oral health and diabetes. So, inflammation is a central mechanism that links diabetes and periodontitis. And when I say inflammation, it's always like a pro inflammation where the inflammation is not on a very active state. So, the inflammatory cytokines such as tumor necrosis factor alpha and interleukin 6 increases in both the conditions. So, in diabetes, the immune dysfunction amplifies periodontal inflammation, leading to bone loss. Whether in periodontitis, in turn, increases systemic inflammation and it contributes to insulin resistance. So in both the ways, the pro-inflammatory cytokines and the inflammation plays a bigger role in connecting both the two diseases and giving them a bidirectional relationship. Another important condition often seen in diabetic population is oral infections. There's a lot of opportunistic infections, and as we have understood till now, because of xerostomia, because of the alteration in salivary quality and quantity, alteration in the oral microbiome, alteration in the host physiology, there are a lot of opportunistic infections that can play a big role during diabetes. Uh, and as we discussed, oral candidiasis is a common opportunistic fungal infection. Meta-analysis of the studies shows that diabetic individuals are significantly more vulnerable to opportunistic infections, especially the Candida species. And that's why it is very important for a diabetic perspective to maintain oral health in the best shape as much as possible. Now, there's an interesting study where the author has studied, and this study is done in Spain, where the author has studied what are the different kind of opportunistic infections that can happen during diabetes and which are the prominent one. So among the diabetic and the non-diabetic population, the most common Candida species isolated are Candida albicans and Candida tropicalis. So these are the two varieties and variations of Candida species which are often seen in diabetic population. Another important thing is, which we have often seen in diabetic population, is burning mouth, or what we can say that taste dysfunction. It's definitely related to poor glycemic control. The patient often complains of neuropathic pain. There's a sweet disorder almost 6%, and salty taste disorder more than that, around 9%. So emerging evidence suggests that a strong link between taste disorders and diabetes. These disorders may stem from neurological changes and are often overlooked during clinical evaluation. So, I will highly suggest, if you are looking and if you are examining, or even you doing the annual cleaning for a diabetic patient, so always make these, you know, check marks from the patient, like are they feeling any taste alterations in their day-to-day habits of food eating or tasting different savories. This is a very interesting article, and this article highlighted that early identification of taste disturbance in diabetic patients is very critical. Addressing these issues can improve both nutritional intake and glycemic control, and ultimately enhancing the patient overall health outcomes, because patient can have more nutritious food and can have more enjoyable food, and that can lead to a better quality of life. Another significant factor that we are also observing in diabetic population is oral mucosal alterations. People with diabetes also have a high risk of oral mucosal alterations, including potentially malignant disorders. So, routine oral examinations are very essential for early detection and interventions. Especially, detection of the oral lichen planus is very important when we are looking for adaptive population. This is very critical. Wound healing, 100%. It's very, very important to see in a diabetic patient. Even we are dealing with a regular tooth extraction, we are going implant surgery, we are doing any aesthetic periodontal plastic surgery. Wound healing is very crucial in diabetic patient, and it's always get delayed. And it's get delayed because of the pro-inflammatory cyclic phase of the inflammation, impaired angiogenesis, and decreased collagen synthesis. And these changes heighten the risk of chronic wounds and potentially post-operative complications in diabetic population. That's why it is very, very important to manage the post-dental treatment care for the diabetic patients. And in order to maintain that, it is very, very critical to understand how the patient is maintaining his or her oral hygiene and what oral products are used in order to maintain that oral hygiene. And we will be talking about those in next few slides. Now, this is an important article that shows that why it is important and how the post-op infections are very in high number in patients with diabetes. Another article that highlighted the importance of there are increased periimplantitis cases patients with diabetic conditions. Now, the most important thing, proper oral hygiene is the key in diabetic population. I mean, as from a dental health professionals, we cannot control the whole holistic overview of diabetes in a realistic world. So we can emphasis on maintaining proper oral hygiene. And a key message here is prevention is always better than cure. Oral health manifest maintenance in diabetic patient is not an option. It is very, very essential. It's very critical. And in order to maintain a good oral hygiene, especially in the diabetic population, we recommend these three, four commonly used checkpoints. Recommend always soft bristle toothbrush. Advise diabetic patient to at least rinse 3 to 4 times in a day with a good oral mouthwash that's not detrimental to their oral cavity, doesn't contain any alcohol, harsh chemical, etc. Use safe, diabetic safe oral care products that not only soothe the ulcerative tissues, and they also promote the oral healing. They should have a regular checkup. I will highly recommend, if the patient has an uncontrolled diabetic, and there's some fluctuation of HbAC1 level to have quarterly overview and examination of their oral cavity 4 times in a year. And at the end of the day, if your mouth is healthy, your body is healthy. Your mouth is the gateway of your whole body. Patient always, and as a human being, as an or even all the species that exist in life, so mouth plays a very critical role in nourishing the whole body. And when you are able to nourish your body properly with right amount of food, with the right amount of the minerals, with the right amount of the elements, with the right amount of the vitamins, your overall quality of life gets improved. So that's why it is very, very critical to maintain a good oral health. Now, the most important thing here to understand while dealing with, especially dealing with patients related to diabetes, that oral care products which are regularly you see in the grocery stores or in the general market stores, they are not the best choice. They cause more harm, especially in diabetic population, than benefits. Why? Because these oral care products, commonly that we see in the marketplace, they contains chemicals, harmful chemicals. They contains colors, red, blue, green, yellow, orange, purple. What are they? These are the colors which are not good for the oral cavity, which are not good for the oral body, its whole body itself. They contains alcohol, artificial flavors, too much of fluoride, artificial fluoride. So there's a difference between artificial fluoride, synthetic fluoride, and the natural fluoride. People often get confused on that. They contains high amount of sugar as well. That's not good. Harsh preservatives, sodium lauryl sulfates in multiple toothpaste, and parabens. So all these chemicals which we see in all these colorful oral care products, they are absolutely not recommended in diabetic population because they can cause irritation to the tissues. They will disrupt the oral microbiome of the oral mouth. They will worsen the dry mouth condition, and they will delay the healing process. So the natural mineral enriched oral care products are the way to go because they offer gentle care, they promote healing and maintain good oral comfort for a diabetic population. And we will discuss these products soon. Now, this is an article recently published that mentioned that, and it's published in a high impact nature journal, like effect of chlorhexidine on oral microbiome. So if you are using chlorhexidine as part of the oral hygiene maintenance, you are disturbing your oral microbiome by killing the good bacteria of the mouth. So when you are killing the bad bacteria, you are also killing the good bacteria, so the mouth always gets challenged. So it's very important to understand this mechanism of good and bad bacteria, and that's why these alcohol based mouthwash are absolutely not good for a diabetic population. Another study, that synthetic mouthwash products are not good for the oral cavity. Another research article, right? Another research article that's very important for today's talk, like over-the-counter mouthwash use increases the risk of pre-diabetes and diabetes. So it's published in the Journal of Nitric Oxide. So these commonly used products which are available cheaply in the market, definitely they have involved with a lot of chemicals, colors, dyes, preservatives, sugars. That's not good. Another article that said that head and neck cancer patients should not use these chemical and dye infused products, especially if a person is diabetic and also dealing with cancer survivorship, then it's totally very harmful for using these chemical full oral care products. They also mentioned that the products which are highly concentrated with synthetic fluoride will also affect the neuro behavior of the fetus. So that's also, these studies are recently published, and they mentioned that these chemical based oral care products are absolutely not good. Uh, Fluoride in the water prevent caries, but what about the healthcare concerns? I mean, I don't want to touch into more detail about this topic because it itself is a huge big topic. We have to, for fluoride, we have to understand what is synthetic fluoride, what is natural fluoride. Our body produces natural fluoride. The vegetables, fruits, and many other food items that we consume on day-to-day basis, they contain fluoride. We don't need that much of fluoride in order to maintain your oral health on a daily basis if you are in a good shape. So you don't, on top of that, you don't want to over, you know, populate yourself with synthetic fluoride, and that's bad. So I will not recommend highly synthetic fluoride in any oral care product. Red 40. Recently, the government has banned Red 40 in all of the commercial, products in the whole US, and many of the oral care products also contains Red 40 dye that is directly linked to the cancer. So we can say that, by even the government and the US FDA is also recommending not to use different products that contains dyes. And Red 40 is one of the commonly used dye in a lot of the oral care and different products which are available in the market. There's another study that mentioned that how these antibacterial mouthwashes, alcohol-based mouthwashes, I don't want to quote or name any company's name, but lot of alcohol-based mouthwashes that not only disturb the oral microbiome of the oral cavity, but they also disturb the microbiome of the gut itself, because certain amount or some amount of mouth rinse also slips inside your esophagus, and that's why it is very important to understand that the product which are using for the oral hygiene not only stick to the oral hygiene, you are exposing your whole body for that particular product, and you don't want your body to be exposed to harmful chemical ingredients, alcohol, dyes, artificial colors. Another article that mentioned that how these products are not good. So if everything is bad, right, we are saying that all the oral care products in the marketplace are bad. So what is the solution? So how we can settle ourselves? Solution is the natural oral care products. So when we say the natural oral care products, the whole system of the universe revolves around ocean, because 70% of the human body is water, 70% of the earth is ocean. So even 70% of the oxygen is coming from the ocean. So ocean plays a very important role in overall maintenance of life, as well as nutrients which are available for survivorship in terms of life existence. So the oral care products which are derived from the sea salt plays a significant role in maintaining oral hygiene. How sea salt based oral care products are effective and why they are the good options. These are the reasons listed here. Number one, they are gentle and safe formulation. So because they are deriving from ocean itself naturally, so they doesn't contain any artificial colors, alcohols, dyes, sugars, fluoride, preservative, and all these things when you are not mixing into any oral care product. So you are getting the gentle and the safe formulation that will not harm your body. Secondly, it promotes healing because sea salt itself contains a huge amount of minerals, and that supports regeneration and wound healing, and making it an effective choice for a healthy and calm oral environment, especially in recovering the tissues. The third and the most important is the minerals. So there are a lot of minerals. The sea salt, for example, from the Red Sea has 82 plus minerals. So these minerals play a very critical role in biological processes and enhancing the body's natural repair system. And let's say, for example, sodium chloride present in the sea salt, it dehydrates the harmful bacteria. Magnesium, it has an anti-inflammatory and healing effects. Calcium, It reinforces the cellular barrier functions and giving the oral mucosal integrity and the oral mucosal barrier to prevent itself from the external stimuli. Potassium, it balances the moisture and tissue pH. Zinc, zinc present in the sea salt, it boosts immunity and accelerates healing, and so on. So I can go on with 100, with almost like 60, 70 minerals which are present in sea salt, and every mineral is unique. Every mineral is balanced efficiently. So we have to very much understand about the balancing of the minerals. Too much of anything is bad, too less of anything is also bad. So you have to maintain that optimal balance in order to get the most benefit of an product. Another advantage of this sea salt based oral care products are they reduce inflammation and swelling because of the hypertonic nature of sea salt. It helps draw out the excess fluids from the inflamed tissue and reducing the swelling and promotes the balanced environment in the oral cavity. pH is balanced naturally. Um, as with the latest science and with the latest research articles, as with the recent news coming out, so pH of almost 5.5 to 6 is a quite good pH for where the tooth starts remineralizing. So the sea salt based oral care products put you in that kind of range that really helps you in remineralization of the tooth and the teeth, as well as remineralization of the salivary function as well. It has an antimicrobial action as well. How? Uh, because sea salt also creates an environment that inhibits the bad bacterial growth and therefore reduces the risk of infection. And when the bad bacterial growth is less and it populates and it acts as a feeding mechanism to the good bacteria, so that when the good bacteria becomes powerful, it overpowers the bad bacteria. It's all the balance between how you maintain the oral microbiome, because the oral microbiome is a complex bacterial ecosystem that, when balanced, protests against oral infections. In diabetes, disruption to this microbiome can lead to overgrowth of harmful bacteria and worsening of the oral condition. Now, why saltwater rinse are best for diabetes? Because it can provide relief from soreness, without use of any harsh chemical additives, alcohols, and different kind of dyes. So you are 100% sure that the product you are using for a diabetic population is safe. Safety is the number one priority when you are recommend anything to the patient. That's where your quality assurance starts. Secondly, is that how much is the coverage is there. So it covers almost multiple symptoms: dryness, hyposalivation, microbiome balance, host immunity, and so many things. So it covers a huge portfolio of symptoms that a diabetic population faces. And number third is that it promotes healing. One of the most important challenges that we have often seen in diabetic population, whether it's an oral cavity, a diabetic foot, or you have it, or any wound injury throughout the body, healing is one of the most critical thing, and that gets delayed. And once the healing gets delayed, it increases the chances of infection. And when you have an infection, especially in a healing wound, in a diabetic population, so it will tremendously increases the cost of maintenance, cost of visiting to the healthcare facility again and again. So it's a very, a kind of a tedious vicious circle that patient always get trapped into that. So you have to be very important in understanding what oral care products usually helps patients in better healing and a better wound infection control. Now let's talk about the science. Different, research articles that support this uh, theory. So this is an article that's mentioned that rinsing with saline water promotes human gingival fibroblast wound healing in vitro. So they have mentioned that even the gingival fibroblast cells starts increasing in growth when they are treated with a normal saline. Also, there's a different research articles like how what is the anti-inflammatory effect of salt water as compared to the chlorhexidine. what are the different levels of salt minerals that can really affect the oral cavity in general. But one thing which is very, very important to understand when we are talking about salt is it is very critical to understand all salts are not equal. We have to understand which salt is the best, and in order to judge the quality of the salt, we have to understand what is the mineral content of the salt. That is the most important critical feature. If you have to see, if you have to judge a salt based on the quality, what is the mineral quality of the salt, how the salt is harvested, how is the salt processed, and what is the purity level of this salt. So if you are able to fetch these four answers, irrespective of any salt you use, you can make an informed decision like, am I using the right salt for my patients? So when we talk about the salt, I don't want to go into much detail discussing each and every salt. When we talk about the salt, sea salt from the Red Sea, which is located near to Egypt, is the nature's best sea salt. Why it is best sea salt? Because it contains 82 plus minerals. That's the unique thing, which is found not in every sea salt. Secondly, it is always natural, and that's the main difference. And it is always called like it's like an heart system of the planet Earth, where all the minerals get concentrated and all the minerals get into circulation, and that's where if the salt is procured from that region, it is the best sea salt we can have for healthcare purposes. Often people get confused, like, salt rinse, so I can use regular salt rinse from my home. I will mix 1 teaspoon of salt and mix with water and use it. But no, regular salt rinse is very weak and slow. Table salt is not sea salt, and every sea salt is not sea salt from the Red Sea. So there is a different level of mineral content, there is a different level of purity. So this is a very interesting chart. I will really want you to put focus attention to this. What is the difference between a normal saline or a table salt as compared to the Red Sea salt? The number one and the most important, as I mentioned earlier, is the mineral content. Sea salt from the Red Sea has 80 plus or 82 plus minerals as compared to the table salt that has only two elements, sodium and chloride. Second is the sea salt from the Red Sea is always procured by evaporation and sun dried, where the table salt is always chemically processed and refined. Sea salt from the Red Sea is always organically harvested, where the table salt is heated to extreme temperature and produced commercially. Sea salt, because it is coming directly from the ocean that contains a huge amount of minerals, 82 plus minerals, and it is directly aligned to our human saline system, right? Whereas the table salt, which is produced in bulk in huge factories using a lot of machineries, is not as compatible to human body as the stable as compared to the sea salt from the Red Sea. So these are the big differences that makes a huge deal. Now let's understand some of the science and the research papers behind the sea salt, how it works. So these are the studies. I will not want to go into detail of each and every study because of the time constraints, but these are the studies and these are the references where these studies have been published in the scientific journals. So the research studies confirmed that sea salt has therapeutic properties, wound healing properties, anti-cancer effects, head and neck treatment, mucosal toxicity studies, and they can also even prevent dental caries. Periodontal surgery, anti-inflammatory effects by using sea salt. They helps in maintaining good oral microbial colonization, acute and chronic rhinosinusitis, alveolar osteitis, and early life periodontal disease infection. So these all are studies which have been published and that mention that how sea salt plays a very significant role not only in the oral cavity but overall human health system. So now I want to point out some of the key articles and the research studies that have been published related to sea salt, typically related to the oral care. So this is a very interesting study published recently in 2020 that a patient suffering with xerostomia, when given with a combined mouthwash that contains sea salt, xylitol, and lysozyme, have a very great significant outcome. Then another study, the sea salt-based mouthwash, when it's given, it improves the healing process and the oral hygiene among the diabetic population. Another study that shows that, published study that shows that effect of sea salt-based mouthwash in improving oral hygiene among orthodontic population. So the takeaway message home is that for a diabetic population, when you see any diabetic patient, whether it's a controlled diabetes, and especially when it is an uncontrolled diabetes with a history of HbA1c elevations, these are the key takeaways you have to please keep in mind. Monitoring of the early signs of xerostomia, early signs of taste alteration, early signs of opportunistic infections, uh, examination of the white patches. Everything should be examined at a very, very early stage. That really helps to prevent the complication and help to manage the condition in a very timely fashion. Always provide an easy to understand post dental oral hygiene instruction to the patients. What are the flossing right technique, what is the brushing method they have to use, what kind of oral care product they have to use. And with this world of technology and AI, you can always follow up with the patients in a right way, in a right fashion, in a right time, so that they should not miss their oral hygiene practices. Another important is product recommendations. I mean, dental hygienists, dental dentist, specialty dental practices, all should recommend natural oral care products that are gentle, safe, and does not contain any alcohol, chemical, dyes, colors, sugar. Why we want to put our patient to the risk, which is already compromised because of the diabetic conditions? We really want to heal them. We really want to mineralize the oral cavity with the right amount of the minerals. We want to feed the cells with the minerals, with the elements, with the vitamins, so that they can feel nourished. The healthy cells become more healthier. The oral microbiome become more stronger with a good population of good bacteria. And that's why you maintain a very good oral hygiene in a natural way. And definitely, I always say that dentists play a very key role as an oral health navigator, and we should work very significantly along with the primary care physician in managing the diabetic condition as a whole, not only the oral cavity. So these are the other topics that I always teach on Dental CE platform. So with this conclusion, I will conclude my talk, and I really appreciate everyone for joining today's session. I hope insights that shared today will help you better support diabetic patients in your clinical practice or even your personal care. Feel free to reach out to me for additional resources, collaborative opportunities, or if you have any questions. I'm always open to anyone who is reaching me. And you can reach me through my email, you can reach me through the LinkedIn, or anyway, you can Google my name and I am almost on the top of the Google search. So yeah, do let me know if you have any questions, if I'm not able to cover the questions today or your feedback today. Thank you so much.
Thank you, Dr. Saini. So I do want to remind everyone that the continuing education course is still continuing. We haven't ended it. We have a Q&A now, and that will go on for probably the next 8 minutes, and then we'll be providing you with a code. And then you're invited to stay on to learn where to obtain the sea salt that Dr. Saini was speaking of and more about that particular product. So free samples will be offered at that time. Again, not required for CE credit. We are supposed to disclose that to you. So let me go ahead into the chat, Dr. Saini, and let's look at some of these questions here.
Yeah.
Code will be announced at the end of the webinar. It is not over yet. Are there Are there microplastics in Red Sea salt?
Well, they say because Red Sea salt, the location of the Red Sea is in a very eco sustainable region where you cannot, have a lot of factories. You cannot have a lot of population living in that area, and people are. It's not an open beach. It's not an open area where anybody can go and assess. And most of these plastics and microplastics are always produced by the humans when they go for fishing and other kind of beach activities. So this is a preserved area, so there is no microplastics in sea salt from the Red Sea as far as I know.
Do you recommend water flossers, and is it okay to put the sea salt into the water flossers?
Yeah, I mean, and now again, it also comes to the picture what kind of sea salt you want to put in. So if you want to put any sea salt from a grocery store that has a high concentration of a sodium and a chloride, it may disturb your water flosser. But if you are putting the right amount of a mineral enriched sea salt, such as the sea salt from the Red Sea, and that also contains other elements like xylitol and lysozymes, altogether it will be a very, very good uh, oral irrigant for water flosser. I highly recommend it. You use Red Sea salt based oral rinse for your flossers.
Will rinsing with Red Sea salt help a person with chronic necrotizing periodontitis?
Yes, 100%. Because as I mentioned, when we are dealing with the chronic necrotizing periodontitis, it's a condition that's go beyond the regular chronic periodontitis, and at that particular point, you really need to build the immune system of your oral mucosa and your gum health to a certain level that it can start fighting against the bad bacteria, or we can say that periodontal pathogens, especially like Periodicilla intermedia or Tenerilla forsythia or Fusobacterium nucleatum. So these are kind of a more periodontopathic microorganisms, and definitely it will help you maintaining those kind of overcome those population of bacteria.
Dr. Staney, do you recommend to irrigate with chlorhexidine when completing SCRP?
No, absolutely not, because chlorhexidine, again, I have, during my presentation, I have mentioned that there are a lot of severe effects, because when you use alcohol in your rinsing with any diabetic population, even for the general population, why you want to expose a healing wound to alcohol when it's healing? You need calmness, you need minerals, you need a kind of an environment where the cells get feeded with the right elements. And when you are dealing with something, balance is the key. Balance of the minerals, balance of the productivity of the cells, everything should be balanced. And when everything is balanced in the right amount, in the right quantity, the cells will flourish well and respond very well to your immune system. And that's why I don't recommend any products such as chlorhexidine or alcohol based products that shrunk the cells or make the condition more toxic and acidic. That's not good for your healing.
Excellent. So, can saltwater rinses cause increased blood pressure in patients with hypertension?
No. So, okay, let me explain that hypertension usually happens when you have a high concentration of sodium and chloride. And that's okay to understand if you are using a regular home-based salt rinse, because the home-based salt rinse is sodium chloride. There is only two elements. But when you are using Red sea salt, now that's a difference. So the concentration of the sodium and chloride is not so high. Why? Because you have 80 other elements as well. So understand, like, if you have a jar, if a jar contains only two elements, that's sodium and chloride, and correspond to that, there's another jar that has 82 elements into that. So the concentration of sodium and chloride is very less. These are the two elements responsible for causing hypertension. And that's why if you are using sea salt from the Red Sea, you are not getting that concentration of high amount of these elements, and you will not be, we have not noticed any case or any adversity related to hypertension using Red Sea salt based oral care products. So I believe you will be 100% safe.
Just some clarification. Is the sea salt solution you describe a homemade solution? If so,
Hello. No, the sea salt solution that I am mentioning in my talk is not a home-based solution. It is very it's a very patented process how you get these sea salt and how you mix and the formulation of the elements along with the different components such as lysozyme and xylitol. All these are uniquely combined and all together give a synergistic effect, and that's why they are different as compared to the other sea salt based products which are often present in the marketplace.
what
I
about,
can,
oh, go
yeah,
ahead,
go
Doctor.
ahead. Go ahead,
No,
please.
I was just going to go to next question. Are you finished with that one, or would you like me to go
Yeah,
on?
yes, ma'am, please
Okay.
go on.
Can you elaborate more on the inflammation pathway and its link to diabetic insulin tolerance development in patients managing their diabetic condition?
Yeah, as I mentioned that there's a bidirectional relationship between uh, diabetic and oral health. And this bidirectional relationship is driven by elevated pro-inflammatory cytokines, interleukin 1, interleukin 6, and tumor necrosis factor alpha, oxidative stress, and immune dysfunctions. So in diabetic population in general, there is a production of advanced glycation end products, which we commonly say as AGEs, and these are the harmful compounds that are formed when protein or fat combines with a sugar in the bloodstream. And this process gets accelerated in diabetes. And these elevated AGE levels contribute to chronic inflammation and oxidative stress and damaging tissues and impairing healing. In the oral cavity, AGEs exacerbate periodontal disease by promoting collagen breakdown and reducing tissue regeneration, and this impairs the immune system. So it's a bidirectional relationship because of the continuous pro-inflammatory cytokines which is present in the oral cavity because of the consistent oral inflammation which is present in the oral cavity.
When
Yeah.
rinsing with red sea salt, will it sting any oral lesions?
No, in contrary to that, when you are rinsing with red sea salt rinse, especially that contains also xylitol and lysozyme, you are actually calming the oral tissue. You are actually calming the wound healing properties, and you are actually feeding the healing cells with the right amount of the minerals so that they can perform to their max. It's all about how you are trying to create an ecological balanced nourished environment around the cell, because these healing cells act as a machinery, and each cell is an individual machine. So when you give machine a right amount of lubrication, a right amount of gasoline, a right amount of all the resources, it performs to the max. So that's why we really, when you feed and when you rinse with the red sea salt based oral rinse, the cells get nourished and they perform better, and that's why you have a more better and better healing results.
What are your feelings about the recent studies on xylitol and possible link to cardiac conditions?
So yeah, so again, I'm just giving an over umbrella talk here about xylitol. So xylitol, it also depends what is the source of xylitol, from where the xylitol is sourced. Is it synthetic xylitol? Is the xylitol get from vegetables, right? So there's a different ways of getting a xylitol. So if you are using the right amount of xylitol, the right quality of the xylitol, and the right amount of xylitol, and if everything is balanced, you don't have to worry about anything. But if you are using synthetic xylitol, cheap xylitol that is also mixed with different fillers in order to make it in a bulk quantity, as done by a lot of the manufacturers in order to get profits in the businesses, then you get trapped into that xylitol. Same with the fluoride. Are you getting a synthetic fluoride or are you getting a natural fluoride? So it all depends upon what is the source, what is the quality, and how much, and it will make a or break a deal.
Okay, on the screen there is the code. Passcode, please write it down. Dr. Saini, let's take a couple more questions here. What
Yes, ma'am.
about pink Himalayan salt and red salts that are over the counter? Are they not real? Are they fake salt without the minerals you spoke of?
Yeah, so Himalayan salt is not a sea salt. So Himalayan salt is a rock that is present next to, continent of Asia and Nepal in Himalayas, and it is not sea salt, and the Himalayan salt is usually excreted and excavated through heavy machineries. And during excavation process, there's a lot of rusted machineries are used, and that's why they have high concentration of iron and other minerals which is not required in the body at too much of quantity and too much of concentration. And that's why Himalayan salt is not compared to the sea salt, and definitely sea salt is not compared to the Red Sea salt that contains 80 plus minerals, hand harvested and unrefined.
Dr. Saini, I want to thank you for your presentation. Have you stay on with Mr. Eddie Kolos here. We're going to show a quick presentation on the sea salt, how you can obtain it. We do recommend staying on for a few minutes because you'll be able to obtain free samples. You can also tap on that blue banner at the top of the screen to obtain free samples right now. But hear from Eddie Kolos about the product, the history, how you can obtain these for your patients, and I believe there's a promotional offer as well. So I do want to thank you again, Dr. Saini. Please stay on for the Q&A with Eddie after the video. If
Yes,
there are
ma'am.
any questions, again, we do invite everybody to stay on, and the quiz link is in your handout as well as in the chat area. Passcode 128537. I'm going to go ahead now and turn this over to play Eddie's video. So Dr. Saini, go ahead and mute for me if you haven't. I will mute as well.
Hi, I'm Eddie Kolos, the CEO and inventor of the first ever sea salt healthcare products. Today, I'm excited to introduce to you H2 Ocean, a global leader of sea salt healthcare products since 2001, pioneering the use of sea salt-based products in healthcare. Over the years, we have developed more than 32 products across various categories, distributed both in the US and internationally. Our commitment to excellence has earned us awards for Entrepreneur of the Year and globally recognized. We are not just about business, but we're also deeply committed to ocean conservation. At the heart of every H2 Ocean product is sea salt from the Red Sea, known as the world's most mineral-rich sea salt. This hand-harvested, unrefined sea salt contains over 82 trace minerals naturally aligned with the human saline system. This unique composition is what sets us apart from all the other products. We uphold the highest standard in quality in our production. Our products are patented, cruelty-free, and manufactured in an FDA-registered facility. We are committed to continuous innovation and development, ensuring that we stay at the forefront of sea salt healthcare. Now, let's focus on one of our flagship products here, the H2 Ocean Healing Rinse, the world's first sea salt-based mouthwash. What makes this so special? The key ingredients: Red Sea salt, enriched with 82 trace minerals, hand-harvested, unrefined, and perfectly matching the human body saline system. Lysozyme, an antibacterial enzyme that enhances immune system's protective function. Xylitol, a natural sweetener, approved by the FDA and widely accepted in the dental industry for its oral health benefits. Our sea salt mouthwash offers excellent results in various oral health issues, including dry mouth, bad breath, post-extraction care, implant hygiene, and daily oral care. It is safe for all ages, including diabetics and contains no alcohols or dyes or any harsh preservatives like fluoride or added sugars. It's scientifically backing. H2 Ocean's mouthwash isn't just a product, it's a scientifically proven solution. We conducted extensive studies on its effectiveness in treating gingivitis, dry mouth, dental caries, and for orthodontic hygiene. These studies have been published in reputable scientific journals. H2 Ocean has become the #1 post-dental care mouthwash for surgery, orthodontics, and implants. We offer excellent patient compliance with our cleaning with healing approach. Our product comes in 2 natural flavors, the Arctic Ocean Mint and the Lemon Ice, in 3 different sizes to suit your various needs: the 64 ounce, the 16 ounce, and the 8 ounce. For dental professionals partnering with H2 Ocean, we offer both clinical success and financial growth. We have 2 main partnership programs. A wholesale partnership. This program offers significant discounts, allowing partners to generate additional revenue. For example, our 8-ounce mouthwash bottles, we have a manufactured suggested retail price of $10, but they are available for our partners for just $5, offering a 50% profit margin. The affiliate program. This is a flexible, zero commitment program that allows partners to earn without any overhead costs or inventory hassles. It's a simple 4-step process to get started, and partners can potentially earn a minimum additional income of $13,000 annually based on referring 100 new patients each month. H2 Ocean is more than just a product. It's a revolution in oral care. Our sea salt-based mouthwash offers unparalleled benefits backed by scientific research and trusted by customers and industry partners alike. We invite you to explore partnership opportunities with H2 Ocean. Whether you're interested in the wholesale program or an affiliate program, we're here to support your success. Thank you for your time today. If you have any questions, please don't hesitate to contact us at info@h2ocean.com or call us at 772-219-8183. Together we can transform oral health care with the powers of sea salt. Thank you and enjoy. All right. Hello, everyone.
If you have any questions, I think Dr. Rowling is facing difficulties. So please type your questions in the chat and Eddie or myself will be able to address those questions.
Here she is.
I was booted out.
Okay.
Is the xylitol in the over-the-counter products mostly synthetic?
If that's a question for me, I think I don't know what other products actually use the type of lysis or xylitol. I was one of the first to bring xylitol into the United States back in 2005 in the dental market in our mouthwash. We are still using the same one. As you know, years go by. If there is a market for it, there will be other manufacturers, either from China or somewhere, that they're going to make it for cheaper, and they're going to fill it with fillers. And those are not something that we would ever do. We want to keep a high quality and a premium product together. So Once testing is gone through, stability testing, quality control, we stick with our brand and our original xylitol that we use, which is sourced from a fruit and vegetable source, and it's natural.
Is sea salt safe for daily use?
Yes, it is, and it should be used daily. But if you're using it from the grocery store, just make sure you're reading your labels and find out the origin and where it's coming from, because not all sea salt is the same, like Dr. Sani had also said. But we wrote a book on the science of sea salt, and many of the scientific researchers in that book also had recommend the red sea salt is the best sea salt in the world. It is kind of a little small finger ocean that is not containing any of the contaminants like the microplastics and other heavy metals or even algae blooms, which you don't want to deal with.
Is red sea salt actually red in color?
No, it's not. It's absolutely white, and it's sun dried. It comes out white right directly out of the ocean.
Can patients buy this on Amazon?
I don't see it sold anywhere. They will not sell it for reasons because it is unrefined and there's only a limited source. So you definitely, like us, have to be locked in as a distributor of it.
Can you mention what's the ratio of water and ratio for a rinse? I'm not sure about that.
Well,
Lorraine, go ahead. I'm sorry.
that's kind of our trade secret, but I will give you, we always say, measuring it through weight or volume is not the same, because either it's granule or fine, coarse. It also can have moisture in it. It won't come out the same. So it has to be measured with a specific gravity meter to get your salt to match, if you want it to match your body's immune system or in your saliva, or not go over, because anything that goes over the amount could be just a little bit harsh for your new cell growth. If it's lower, then it's deficient in the mineral content, and it'll be not as perfect for your super healing powers.
Any contraindications to using red sea salt?
Not that I know of at all.
Any age restrictions?
Nope, safe for all ages and all types of people.
And how long would one bottle last? And what is the shelf life, Eddie?
You got a 3-year shelf life, and it also, after opening, it can be kept on the shelf for over 2 years after opening without any growth of bacteria. And that's because of the combination of the other ingredients that we put in there. No harsh preservatives or anything. But yeah, it's pretty much safe to use, and also swallow if you swallowed a little bit of it.
Any other questions for Eddie or Dr. Sani, please type them in the chat area. I do want to remind everyone that this presentation of Eddie's, as well as Dr. Sani, in your course folder, as well as more information about H2 Ocean's products. Take it back to your practice tomorrow, and be sure to tap on the link at the top of the screen. You can claim free samples, learn more about partnership programs as well. Question about, is it possible to exacerbate xerostomia by rinsing with red sea salt?
Dr. Rajiv, you want to answer that one?
Yeah. I will say that xerostomia is basically a situation that can happen due to multiple reasons. Maybe systemic health conditions due to diabetes is one of the situation. You can have, xerostomia related to your chemotherapy, radiation therapy. You have oral conditions where you have reduced salivary secretions or the quality of the saliva get decreased. By using Red Sea salt based minerals or the oral care products such as S2 Ocean Healing Rinse, you are actually feeding the oral cavity with the right amount of the minerals. And not only about the right amount of minerals, the right balance of the minerals. So here the balance and the quality matters the most. And when you are constantly feeding your oral cavity with the right amount of the minerals, what you are doing is that you are increasing the oral mucosal immunity. And once you have your built up, start building your oral mucosal immunity, then you can see that changes starts happening in the oral cavity. And definitely, we cannot claim that using a mouthwash you can get, cure for your xerostomia, but you can get 100% relief for your xerostomach conditions by feeding the right amount of the minerals and lubricating the oral cavity with xylitol as well as protective mechanism from lysozyme. Lysozyme is a natural enzyme present in the human body. It is secreted in your saliva, your tears, your semen, woman's, mother's milk. Everywhere the lysozyme is present. So when you are giving oral cavity that amount of lysozyme, xylitol, and the minerals all together, they all gives a synergistic effect that can makes your xerostomia in a very well controlled situation.
What mineral distinguish, excuse me, which mineral or minerals distinguishes Red Sea salt versus other sea or ocean salt?
Well, we find that there's more mineral and trace mineral content in the Red Sea because the Earth is actually mineralizing the ocean from the Red Sea, and then it follows the currents of the current belt of all the oceans are connected. So not every part of the planet has these type of minerals in it. And if you know a little bit about marine biology and saltwater aquarium businesses, you can know that the most brightest corals, the most delicate corals, the most precise, like perfect specimen of fish and you know marine life actually are from the Red Sea. And I mean, there is other places too, long as it's a clean ocean, that are safe. But we're just saying that that is the Red Sea. The Red Sea is like the heart of this earth. That's why it's called the Red Sea, and that's what I believe.
Uh, Dr. Rowling, I am seeing like the banner is missing. If you can place the banner,
Oh,
so if
great.
someone
Thank
wants
you.
to,
Yep.
yeah.
There's a timer on that that is supposed to be indefinite, but sometimes
Okay. Okay.
it does not pay attention.
Yeah.
Okay, let's go on. We've got some more questions here. With these rinses, besides bacteria, will it also disrupt the good bacteria?
No.
No.
The reason, as I mentioned during my talk, is that the good bacteria and the bad bacteria. So the good bacteria takes those minerals and becomes more powerful and then overpower the bad bacteria. So that's how the oral microbiome is balanced. So when we are trying to take alcohol-based oral care products or the chemical-based oral care products, then they disrupts everything. So everything is killed, whether it's good or bad. It doesn't distinguish. But when you are using the natural oral care products, you are supporting the good bacteria in order to overcome the bad bacteria, and hence you maintain a good overpopulation of a good bacteria.
And I can add to that, lysozyme exists in our saliva, our tears, and our saltwater system in our body. As because it's existing in our bodies, and most other mammals, even plants, have some lysozyme in it. It knows how to fight off the harmful bad bacteria. It's our first defense against airborne bacteria, and it's pretty much our first defense of our immune system. It consists mostly in our open wounds, like in our mouth, our eyes, our nose, protecting us from the airborne bad bacteria that we breathe in or that we actually take in too as well. It goes after mostly the gram-positive bacteria, and I could go into that for a long time, but it would take a little longer.
We've got several people, Eddie, they would like to know where to purchase your book and the name of the book.
The book is called The Science of Sea Salt. And you could look it up on scienceofseasalt.com, or you can also look up h2ocean.com. We should have somewhere on a link or a button to.
So I just dropped the link where you can find the book details and where you can purchase that in the chat. So anyone who is interested into that can look into that. And it's a book written about the whole, I can say that encyclopedia of science of sea salt, how the sea salt functions from the environmental perspective to the food, to the oral health. And Eddie and myself co-authored this book along with 70 plus different authors around the world who gives their advocacy towards the benefits of sea salt in human health in general.
And there's no other book like that in the world.
Yeah.
It's like a textbook. It's 500 pages, a lot of pictures, a lot of stories, and a lot of scientific data in there as well.
Are these rinses safe for thyroid medication taking patients?
Yes.
Do you have other products with sea salt besides oral rinses?
Yes, I created about, I think, somewhere around 40 products. We have a sea salt toothpaste that's coming out in the marketplace, probably within the next less than 2 months that we should have. But we do have sea salt in pretty much our whole product line that we've made, and that's why it's called H2 Ocean.
We have questions from a dental hygienist. Are they able to be affiliates with H2 Ocean?
Yes, they are.
Okay, any other questions for Eddie or Dr. Saini? Can you distinguish again between Himalayan salt and Red Sea salt?
The Himalayan salt is mined from the Himalayan mountains, which is in the Asia area. It is mined also with heavy machinery, excavating it as it became something that the food industry was promoting, and they have a lot of high contaminants in there. So high heavy metals that your body might not be able to get rid of. So I don't even suggest using that as our food salt anymore. I think it's not a pure form. And the Red Sea salt that we use is unrefined, comes from the ocean, and it has a higher amount of trace minerals, and those trace minerals all are already found in our bodies. We are 70% saltwater beings, and the earth is a 70% saltwater ocean. So we're getting it right from the source, and I believe that it has great healing properties. And we know that for sure because of all the scientific data that we have.
Do you have a catalog for orders with all of your products?
We do, but we are kind of in different industries. We're in the dental market, we're in the tattoo market, we're in the hair care market, we're also in the diabetic wound market. So there are different catalogs. We don't have one that is across the whole board. We just have our website that you could see.
Okay, well, I think we have managed to answer the questions for this evening. One more. Well, I think you mentioned this before, Dr. Saini. Elaborate a little bit about chlorhexidine, please. We have a couple of questions and
Yeah.
why it's not beneficial.
Yeah, so when we talk about the synthetic oral rinses such as chlorhexidine or alcohol-based mouth rinses, so there are a couple of key disadvantages which should always keep in mind. Number one, these are alcohol and chemical-based products which are not only safe for your oral cavity, but they are also not safe for the whole body itself, because as we have seen, there are a lot of research and science that mention that even you using alcohol-based products, they can increase the risk of oral cancer itself. Secondly, they are not good for the oral cavity itself because it disturbs the oral microbiome, which is very critical in maintaining your good oral health. Number third, they will disturb the healing cells because the healing cells need calmness in order to heal properly without any disturbance, without any irritation. It's the same way you want to, if someone is fall sick, you want to keep that person in a calm condition, in a dark condition, in a cool environment rather than putting him outside the sun. So you want to avoid any harsh external environment in order to
Stinging and
make
burning
that.
is not good.
Yep. So I mean, these are the few factors that you really don't see in these kind of chemical-based products, and that's why when you come to a picture of the natural oral care products, such as from the sea salt, that's the huge difference. You will get that calmness. You get a gentle but perfect oral cleaning without compromising your oral microbiome, and it's 100% safe. And on top of that, you are nourishing your cells with the right amount of the minerals. So it all depends what you take. It's a similar fashion. If you want to grow up yourself or you want to feed yourself, the fast food throughout the day, throughout the year, what you can expect from your health. If you want to give your body the right amount of the food, your body will perform well, your brain will perform well, your heart will perform well. Same is the oral cavity. Your salivation will be better, your gums will be better, your teeth will be better, your oral cavity itself is the better when you're using the right amount of the oral care products.
Excellent.
In a short version, feed the body what it needs and what it's made of. And I see a great question there too that I don't think was answered about swishing or swallowing for gut health. I can answer that right now. I swallow it every day, and about a capful. And if I did have any kind of problems with the stomach, either food poisoning or just a bad stomach from whatever it could be, I've drinking the whole bottle. It has not affected me in any way that, except for helped my stomach aches. And it helped my stomach aches multiple times, and a lot of my employees too. If I hear that they're having an issue and that they can't come into work because they're sitting on the toilet. So it is safe to swallow. We don't say that it is a drink because it's not. And I can tell you that just spitting and swallowing it or spitting it out and putting it in your mouth, the body is going to take the minerals, what it needs, and use what it needs and get rid of anything that is excess. So that's how the body works.
Is this also good after oral cancer?
Oh yes, this is the one of the best mountains that a person can have as a cancer survivorship. All the key medical hospitals, research centers, cancer clinics, hospitals, including MD Anderson Hospital, that's the world number one in the cancer care. They recommend salt rinse as the number one remedy for managing the oral mucositis or the ulceration inflammation caused due to chemotherapy or radiation therapy. And Eddie and myself last month attended a very good oral oncology conference with MD Anderson Hospital, and we discussed with a lot of key people there, from the key oncology persons there, like how you think about sea salt rinse, and they are very much excited about this. And we are really, discussing potential collaboration opportunities with them as well. So, sea salt rinse, especially the red sea salt rinse, manufactured by H2 Ocean as the H2 Ocean healing rinse. is the #1 patented salt rinse for cancer survivors. And we have a separate seminar on chemotherapy through Dental CE Academy, where you can register yourself and get a complete information about how it is workable in these patients and how the patients get benefited.
And we've been sampling a lot of cancer patients too with good results, great testimonials, and also have some clinical studies on that too as well. So it's proven to help out people from the start of their chemo to keep them from getting dry mouth and getting rid of the metal taste out of their mouth and being able to eat and swallow without any pain.
Excellent. Thank you so much, Eddie, and thank you to H2 Ocean for supporting the program this evening, and certainly to Dr. Saini for his excellent continuing education program as well. If you have any further questions for either Eddie or Dr. Saini, please reach out to them through the contact information. The blue banner at the top of the screen, again, you can claim a free sample. You can also bookmark that URL to your device, take it back to your practices. Do either of you have closing remarks before we go ahead and adjourn?
Well, I can give my concluding remarks is that try to, push yourself as well as your patients to the natural oral care products and try to avoid those chemical-based, alcohol-based, dye-based products that not only affect the oral cavity, but it's going to worsen your whole body itself. So try to be natural, try to be safe, try to be effective, and try to be, advocate towards the mineral-based oral care products that can really help you as a patient, not only the oral health, but overall oral systemic health relationship. Thank you.
And also try the products out for yourself. And I know that you have patients out there that are diabetic or even have cancer. Please recommend it, get some feedback, testimonials. You'll see the difference that you can make for a lot of people out there.
Well, thank you both so much. With that, we will go ahead and tell everyone good night, and be sure to thank you all for attending this evening. Excellent questions. As always, thank you, everyone, and good night.
Thank you so much for having us. Bye-bye.
Yes.